So my name is Maxine Mackintosh. I'm a 23-year-old data scientist, having come from neuroscience and then health economics, lots of different changes in direction. I'm a complete digital health and health technology fanatic, and I suppose you need some fun facts when you do an introduction. So I love fancy dress. I love really, really hot curries, and my favorite color is orange. So I'm doing a PhD at the moment, but it's in health informatics. And data science, as you well know, is this new field. It's only about 10 years ago, data science, the field didn't exist by name, but obviously data widgets. And now all these health informaticians are being called data scientists, but they're still using things like Stata, which is sort of drag and drop statistics. But no, I do use R, and because I think it's just so much more powerful to analyze these massive data sets. And especially when you're looking at healthcare, it's, in my case, I'm looking at patient records. So I've got 20 million patient records that I'm looking at. And you can't really do that with drag and drop statistics. So yeah, I am using R. I haven't really got into the Python bit of it yet, but a number of people in my lab do use Python. The one thing I've realized being quite new to data science is actually that people have different parts of the pathway that they're involved. Looking at data, you have someone who cleans it, someone prepares it, then you have someone who kind of analyzes it, you might have a different person to visualize it. And if you can do all of that pathway, well, more power to you. But I think most people generally focus on one element. So it comes to us in fully anonymized form because it's medical data. So it does have to be completely anonymous. And it's just rows and rows and rows and rows, 20 million rows, in fact, per patient of lots and lots of different things, be it the date that they went into a hospital, what kind of tests they had, when they were discharged, diagnoses, that sort of thing. And that is your medical record. And you'd think we have one NHS, so we have one medical record, but no, we've got about 20. They don't talk to each other, and then that's in primary care, so your GP, and then you've got your secondary care, and then you've got death, and you've got all these different data sets that aren't linked and don't talk to each other. So it arrives technically in an unlinked form, and it's up to different people to put it together and put it in a form that can be analyzed. So when I get hold of it, it's linked primary care, secondary care, and death. And this is with your patient ID, because everyone in the NHS has one patient identifier, which is why in the UK we're in a very unique position to do really serious population health analyses. And then I at the moment, I'm looking through medical records to find new predictors for dementia. So I'm taking people who have a dementia diagnosis back 20 years and seeing, actually, is there something they all have in common 20 years prior to diagnosis that at the moment we're not associating with dementia? So in dementia, you think, okay, memory loss, cognitive decline, but by the time you've got any memory loss, that's way too late. You need to be catching people several years before that. So I'm looking at medical records to see if in a really, really pre-diagnostic stage, there are some symptoms that we at the moment don't think are predictors of dementia, but actually are. So an example is something like gait, so the way in which you walk. That's increasingly becoming a complaint that people comment on in their medical records, saying I'm having difficulty walking, or I'm walking in a different way, and that's coming up in medical records about 10 years before they're actually diagnosed. So interesting things like that. The thing about data science and health is that it's very, very niche, and health people have lots of their own jargon. So you have the data science jargon plus all the clinical jargon. It's just like a double jargon whammy. And I think that's what makes data science and health a little bit unapproachable. So it's quite a difficult thing for people just to dip into. I get the use of health data science because it's just so jargon heavy. Before I started my PhD, I decided to set up something called HealthTech Women, which started off as quite a loose community of women working in health technology. And I thought, this will be fun. This is just going to be a nice little outlet. This is going to be a great thing to curate and get people together and talk about digital health and health technology. And then it actually exploded completely unexpectedly. So that was in about October, November. And sort of 5-6 months later, we're now at 6,500 members. We're a community interest company. It's actually taking up so much time and so much energy, and it's amazing, but it's a serious commitment. So I'm actually stepping back as director to bring on a part-time paid director, and I'll be more involved as a kind of chairman role to make sure that it's still doing what I wanted to involve operationally, because it's just become so big. And I think I think that's been something that's been quite important and difficult for me is realizing when you are the bottleneck. So this is something that I started and I really, really love doing. But I also realized quite recently that if it was going to continue to grow at the pace it was, then I couldn't be in the position that I still was, because I just couldn't get it at the time and energy needed because of my other commitments. So I've got a really, really great team now on board, spread across the country, in Leeds and London. And it's predominantly volunteer led, but we do have a few part-time members, and it's a really exciting, really fun group to be involved in, and it's just completely amazing how quickly it's grown, and the size at which it's grown as well. So the fact that HealthTech grew so big so quickly, I think, is a couple of reasons. Health technology is still quite a new field. There's lots of healthcare groups, there's lots of tech groups, but health tech is quite niche still. If you go to Silicon Valley, there's tons more going on digital health than there is here, and it's definitely really, really growing. I mean, if you look at the way investments have been going in the past, even the past year internationally in digital health, it's just absolutely skyrocketed. So it is a new field that's really gaining momentum. So I think that it was very popular because we're far away from being anywhere close to communities. I also think it was noticed and needed because healthcare itself is so female dominated. So the NHS on aggregate has 77% women, and you think, well, there isn't a problem in healthcare then. Actually, work for the poor men. We need a men's support group. Like, they're so outnumbered. And actually, when you obviously start to go into those numbers, you realize that actually 80% of the admin staff are women, and it's junior nurses, or it's people not in senior positions, and it's not the consultants, and it's that classic professional pyramid. And then if you start to go into the more med tech health technology, then the numbers drop even further. So you're sitting between kind of 7 and 25% according to what part of med tech you're in. So you think, okay, well, that's a subset of healthcare, so that's not very important. But actually, it's important to step back and think, where is healthcare going? And as you well know, like most industries, healthcare is becoming increasingly dependent and driven by tech and tech-based innovations. And the future of health is digital health. And so, given the fact we have so many working women in healthcare, yet they're not in the position to be driving the innovation and being at the forefront of where healthcare is going, that's going to be a bit of a problem. So I think it's just to get more women discussing and literate and confident and excited about the future of healthcare as well. And I think it was noticed that there were very few women engaging in those discussions. So HealthTech Women has a number of different arms. At the moment, we're quite events-based, but we're building out a number of different schemes. So our events have been quite random within the health technology sphere. So we had a Virtuality breakfast last week where someone was showcasing the use of Virtuality for OCD, and and we had amazing people doing it for surgery. I have to say the OCD example is particularly amazing because they have a bathroom which is just filthy. You can effectively dial up how filthy the bathroom is, and it's this exposure therapy based technique. So you've got this Virtuality disgusting bathroom you just have to confront with, and it's to help people overcome this. Quite an interesting one we had last week. We've had ones about cross-sector fertilization, I guess. We had Tinder, we had BT, and we had some blockchain people come and talk about different technologies and how they can be applied in healthcare. We've had ones about artificial intelligence. We've had ones about cybersecurity. So broad, or each within a particular theme, not just digital health, but a topic within digital health. But they are, we're purposely covering a lot of different ground and trying to capture different people within the health technology sphere. On your point about machine learning and artificial intelligence in healthcare, that application is so obvious because the way in which a doctor makes, you have this, no, yes, no. It's basically just a yes, no tree. And you're cross-comparing lots of different potential interactions or potential symptoms. So that's just like your classic algorithm. I mean, it is algorithmic thinking. And doctors are people that have really, really, really stressful work environments, stressful lives, and can't really compute all that is medicine. Actually, think about it. That sort of decision making can be done so much more effectively and so much more powerfully and so much more quickly by a machine. That is definitely, I think, very much the future of medicine, and it's now increasingly likely, again, with most industries, working out where the human lies within this discussion. And obviously within healthcare, I think most people agree the fact that care fundamentally will need to remain human to human, but there are elements in the system that can be digitized. So we haven't hosted any hackathons per se, but we link up to a number of them. So we will be working with the NHS Hack Days, because I went to one of them recently at King's, and it was a fantastic event. People came up with the most amazing things over the weekend. Like with most hackathons, you're always blown away with how incredible how incredibly someone can come up with that technology or that piece of kit in a weekend. But the hackathon had very, very, very few women. It was, even though it was an NHS hackathon, and as I said, there are so many women in the NHS, there were a handful. So we're going to be partnering more with hackathons just to make sure people feel confident and feel able to go to them, because confidence attending hackathons is a big thing. I mean, I always say that attending your first hackathon is probably worse than losing your virginity, because everyone turns up, you turn up and everyone knows what they're doing. They're all, just starting opening their, our studio already, and you just think, God, how am I even going to start? And then IBM's hosting a hackathon, which we're partnering with, and there was a plastic surgery hackathon. So I think we're more about partnering up with hackathons that are already running and providing that channel of access for people within the community to join normal hackathons, as opposed to have an exclusive hackathon ourselves. So because HealthTech Women grew so quickly in quite an unexpected manner, we didn't maybe invest in our infrastructure as much as we should have. So our next few months are very much focused about consolidating our foundations and making sure that our database is really rich and curated. We're going through a new website to make sure it's a really well-documented repository for people working in the health technology sphere. And we're running a number of programs, including kind of legal clinics for female-founded SMEs, so free legal clinics to provide legal advice. We're providing transition programs for, I suppose, more traditional PhDs and postdoc academics to then move into industry. We're running all sorts of things around mentorship as well. So we're building quite a big repository of mentors, both men and women, who just want to help mentor people within the health technology sphere. And so just operationalizing a lot of that. A lot of this is about operationalizing what we're doing. And we spread nationally very quickly. So now it's about making sure that every city that we spread in, so Leeds, Sheffield, Newcastle, Manchester, London, Oxford, Cambridge, we're making sure that those communities are not just one-off events, but there's actually communities going on within each of those respective cities. So I think for the next couple of years, it's very much about making sure that each community is thriving in their respective locations. But also, we're working very hard to engage the clinical community a bit more. So we brought on a new clinical director. And the idea is that hopefully she can help get clinicians to engage in this a lot more, because they're going to be the ones to really drive a lot of these innovations, but they, by and large, don't have the bandwidth or the confidence or the knowledge to know how to actually innovate within medicine or create their own startup or at least team up to see if they can find a solution together. So I think the exciting things about health technology is this whole idea of democratizing of healthcare knowledge. So in the olden days, your doctor used to know all the information about healthcare and you knew nothing. And so it was this hyper-paternalistic, very separate thing you'd engage in. You would never know anything about your own health. But basically, thanks to Google, people are significantly more knowledgeable about their healthcare. And that means that people feel equipped with the information and with access to the knowledge that they actually can do something about it. So I think it's this whole democratizing of healthcare, and the fact that technology might not be the solutions, but it's the means by which you can further democratize that knowledge and further democratize that access. Like with most industries, there's all these kind of mantras. So you've got one of them being this people-powered health, by the fact that actually users of healthcare are patients, and patients often in the past haven't been engaged in driving the innovations of that disease area or that condition. But again, with technology, you can actually get patients to be the ones to be designing it and building it and deciding how to drive the treatment of that condition, because they're the ones suffering, or they're the ones who are the patients. So I think you can just access significantly more people to get involved and start innovating. And that's, I think, the really exciting thing, because it's not just to the behest of doctors to drive that. So I think that's a really exciting thing. I think, secondly, after democratization, I think it's this whole wellness healthcare gap. So people see wellness as this sort of faddy, hippie, unevidence-based thing that we do, be it yoga or gluten-free or anything related in that respect. But regardless of whether you agree with lots of yoga or gluten-free, the point is that it's this whole wellness sphere, and actually wellness is the key to prevention of diseases. And so it's about closing that gap between getting people in their own homes, making sure that people are staying out of hospitals, so you're basically keeping healthy people healthy. And that's a huge thing that tech can do, because it can be on your smartwatch to tell you, hey Maxine, you've sat at your desk all day, get moving. Or it can say, you've only inputted bags of crisps today, you need to do something about this. Or actually more seriously, you can say you need to do your blood pressure, and you can just have a device on your phone that does that, and you can say, hey, your blood pressure is a little bit high, you might want to take XYZ, and then go see your GP. So it's all these things to basically get people in their own homes so they don't have to go to hospitals. So I think those are the kind of really exciting bits, is the fact that you can start to really do prevention, and you can get that at a population scale by engaging lots more people in that innovation. In terms of people trying to get into it, unlike many areas, I think that a fair amount of understanding, because healthcare is not just health, it's sitting within a really, really complex physiology, it's sitting within a really, really complex health system infrastructure. I mean, it will take you years to get your head around how the NHS works, for example. So I think for any people wanting to start to work in healthcare, it's really about problems are and understanding what that sphere is. And that whole thing is just attending events, meeting people, getting stuck into projects, because that's the only really the way that you can start to understand how healthcare works. And it's just so complex, it's not something you can just dip into. I mean, even if it's constantly changing and you can't just set up a company without the right regulations, Theranos being a fantastic example. So I think really taking the time to isolate the problem and to isolate what's happening in healthcare and how technology can do that. And that's just about attending events and talking to people and getting stuck into projects. So I think that's probably what I would give, would be to take it slow and spend 90% of your time information gathering and problem identifying, because then the solution will be quite evident. There's a growing number of health technology communities and groups and that sort of thing. There's one that's very big internationally, and that's called Health 2.0. So they run probably about 4 or 5 meetups a year. And you've got the HealthTech Innovation Labs, which is another community based in London. You've got the Health Technology Forum, and these are all kind of based on Meetup. Actually, a lot of it is through Meetup. And of course, you've got Health Tech Women, and we have by far the most fun and exciting and educational events. But no, there's a fair number of them. So if you type in digital health or health technology and health tech into Meetup, you'll get a fair smattering of them there. I suppose if I had an advice, it was the fact that I'm constantly exploring. So I did neuroscience and then moved into social science, health economics, whilst doing lots and lots of very explorative internships. Then I got more into tech and started investigating further research in data science. And these are all really different spheres, and I've done lots of different things professionally. It's because I'm constantly exploring. So I think my bit of advice would be that it's okay not having direction, as long as you are trying lots of different avenues. And then when you do hit something that you like, that'll really strike a chord, and then you'll know you're pursuing the right direction. I think that would probably be my one bit of advice, is always explore and always try something new.